Hi, I'm Kimberly Katz. I'm 29 years old and I'm from New York City. Living in New York, my life is very social, going out to dinners, going to shows, going to different concerts. I had a lot of fun. I work in sales, which is also very social. And I love traveling, having an active lifestyle. I actually used to go to Central Park every day and go on the Jackie Onassis walk. It was good for my soul. I love to see people. I believe it was a year ago, I thought I was getting migraines. Like, I worked virtually, so I would have to get off my computer for an hour and lay down. And then when I would have those episodes, I actually went to the doctor and they thought there was something wrong with my back that ended up not being a part of my back. After seeing multiple doctors that kept telling me I was healthy, capable to function, it really gave me a sense of confidence. I thought I was functioning well in my life, and now reflecting, I wasn't as high functioning as I've been in the past because I wasn't being as active. I would have to sleep more. There were points that I actually wouldn't even go to the grocery store because that's how tired I was. So I convinced my dad to let me come for Christmas, and thank God I did, because obviously with Christmas you have obligations. They woke me up to open presents and I couldn't even stay. And I went back upstairs, and I believe my dad said I was sleeping for 2 days. He saw me and he was like, "You have to go to the hospital."
Kimberly's condition, when she presented to the hospital, really necessitated the urgency of getting the MRI and diagnosing her. There are a lot of other reasons patients can have headaches that are not brain tumors, and so it's not out of the ordinary for patients not to receive imaging for that. By the time she came to us, the size of the tumor and the swelling around it had reached a tipping point to where she became very sick, very ill, and needed something done as an emergency.
I don't remember getting to the hospital. They did a body scan and then they scanned my brain, and they saw the tumor, and they said that I have to go into surgery immediately.
Her MRI showed that she had a very large tumor coming from the covering on the outside of the brain called a meningioma. It was basically at the base of the skull, and it was in very close contact with some important nerves that deliver her ability to move her eye and control her vision, as well as some very important arteries that deliver blood to a large part of her brain. So it was in intimate contact with those, and it was actually quite a large tumor, and there's a lot of swelling around there, so the brain around there was very sick.
I was so blessed that I went to Boca Hospital. I was so blessed that Dr. Snelling came, because he had a 6-hour surgery. He took everything out and he left my hair. He left me beautiful. Obviously at first it was a bit rough, but my lucky stars were aligned that day, and for the rest of my life it was amazing. I'm so incredibly grateful for the beautiful life that I've been given. I'm definitely choosing to eat better foods, be active every day, go on walks. I'm the biggest fan of the Marcus Neuroscience Institute. The staff was incredible, always so kind to me. Now that we're doing our research, it was the best choice. So I'm very grateful for them. I just have so much gratitude. I have amazing friends. My family is incredible.
Results like hers are why we get into this profession. I think at the Marcus Neuroscience Institute, cases like these are just emblematic of the general type of care that we provide, whether it's complex brain tumor care, complex spine care, complex vascular care. We're able to, on a daily basis, tackle the toughest cases and provide the best outcomes for patients.
Great doctors.